Hi everyone, we're going to show you how to tape an ankle today. A few things you should know about taping an ankle before you start is don't put under wrap on an ankle before you tape it, if you can help that. Get your athletes to shave their legs, unlike Mr. Mildren today who's got his legs unshaven, so it's going to be a bit painful pulling the tape off. But the idea of the tape is not just for restriction of movement, it's to actually pull on the skin and give assistance for your brain to tell your body where your ankle is. So the signals from your ankle to your brain, that pulling of the skin or proprioception is really important. It's one of the major aspects of why we tape ankles, why they're effective. Okay, so to start off, when your athlete's getting their ankle taped, we have them flex their toe, because what we're doing here is making the lower half of the leg as big as it can be. So we're contracting the anterior tibialis, which will be as big as it can be. And we're going to put down two anchors. So if you want to come in closer, so an anchor starts at the shin, and because the ankle is cylindrical, we're going to have to put the tape on an angle. So if we start up high and then we go down lower around the Achilles and come back up high, we're going to have tape that is not creased. Okay? And then if we get a close-up, I'll show you how to tear tape. If you put your fingers and thumbs together, you can tear the tape without cutting it. And you can see that's nice and smooth. I'm going to do another one. I'm going to keep on making sure that my athlete's toe is up. I'm going to put another anchor in. Same thing. Start up high, go down low around the Achilles, and not too tight. And you notice when I tear my tape, I pull it off the roll first before I do the taping, because you don't want to tape off the roll. If you tape off the roll, especially this tape's a bit old, so it's a bit hard to pull off. If you pull it straight off the roll to make your tape, to do your taping, what you're going to do is tape really tightly, and you don't want to do that. So the next thing I'm going to do an anchor. So I've done two anchors, so I'm going to do two stirrups. So again, if you come over this side now, you can have a look at. So I'm going to start at the medial side of the ankle, and I'm going to start towards the calcaneus, towards the back of the ankle, and I'm going to pull it round and then up this way. We tape from the medial side to the lateral side, because most ankles, if you take a shape of this, if you come down and have a look at this, most ankle injuries are rolled out this way, and so we're trying to pull the ankle back up. So the next bit of tape, the next stirrup I'm going to do is going to be halfway on the other tape. I'm going to tape it around, make sure it's nice and smooth, and lock it off. So I've got two stirrups on my anchor, and now I'm going to do a figure 6. So the next one's going to be a little bit further forward again. I don't want to get too far further forward. There is a nerve sitting just here, you can feel it. If you get on that nerve with your tape, you're going to cause a lot of pain to your athlete. So you want to keep taping below that. So if you've got that shot there, have you got that shot? So just here, there's a little, you can feel it. Try and tape inside that. So this is a figure 6. So same thing as a stirrup. I start off on the medial side. I wrap it underneath the ankle, underneath the foot. But this time I'm going to lock it off back onto the medial side. That's called a 6, figure 6. All right, you could do a figure 6 the other way if you want to, but I'm not going to do that today. Just one figure 6 will do us. Now we're going to do a heel lock. We're going to start on the lateral side of the ankle. We're going to aim to go on top of the heel, on top of the ankle bone, and then we're going to go in the middle of the Achilles tendon. We're going to come around underneath the foot, and we're going to lock it off back up on the lateral side where I started. I'll show you another one the other way. So that's a heel lock. And you can see the tape's pretty smooth. All right, I'm going to pull my tape off again. Pull it off before I tape. This time I'm going to start on the medial side. I'm going to go on the top of the ankle bone, across the middle of the Achilles, And you can see I'm watching my tape the whole time. I'm not taping like this, where I'm not watching my tape. So my face, my eyes are watching the tape all the way around. I'm watching it round, and I'm going to lock off back on the where I started on the medial side, and that tape's pretty smooth. Now I'm just about finished now. I'm going to finish off by locking off my tape again. So I'm going to do another anchor, and I'm going to work my way down the ankle now, or down the foot, and I'm going to make sure there's no, you can see here there's a bit of a gap here. This is where you could pinch. So I'm going to cover all this up. I'm going to have a look at the back of it. I'm watching my tape coming round, and I'm just going to lock it off back over here. I've got one more to do, just to cover up that little piece there. Now, if you have a look now, there's my taped ankle. There's not much wrinkles in it. It's pretty smooth, pretty comfortable for Mr. Mildren. I'm watching his facial expressions. He's not in too much pain. And that's his ankle. That's his ankle tape. Now, if you wanted to do an even better job, you could strap it with overwrap, but that's all we have. It's not bulky. It should be fairly comfortable to use.